Kurdistan generally and the Kurdish region of Iraq has a very troubled recent history.
Many wars happened in this area, and sadly it affected the population physically, psychologically, in every ways of life. And the number of cleft patients is very high. We don't know the exact number, but collectively all the things I think led to an increased number of the cleft patients and the quality of health service in our area.
The people in this area, they are always thinking about life, and always thinking about what will be happening in the future, and what they are in fear of that, what happened tomorrow, because we are so many wars in this region.
I think most of the cleft patients, they are from low socio-economic state, and we have so many of them. They are far from the center. They are living in the village. So we have older patients which have been neglected, and also they have problem with the socio-economic states, their finances. So they have problem coming to the center.
The cleft care, as in so much of the world, is fragmented.
All of Iraq don't have any speech pathologists. I am only speech pathologist in Iraq. We have some good surgeon here, but before this team surgery established here, we don't have any investigated before the surgery for the patient, like lateral fluoroscopy or nasoendoscopy or speech assessment.
Previously, about 15 years ago, there were no many plastic surgeons here. So the palates have been repaired by general surgeons and other specialties. So they just closed the defect, and they didn't did anything about the muscle repair, repairing the mechanism for the speech of the baby.
The problems are everyone has a go. There's a lot of very poor outcomes, some real disasters.
The consequence of doing a surgery by unqualified surgeon is very bad. Those patients may get fistula, which may be very difficult to treat, have difficulty in their speech. They may have disfigurement in their appearance.
If a child or an adult has a palate which is not working properly, they often need further surgery. Deciding what surgery is appropriate requires investigations, and there are two main investigations. One is taking a moving X-ray of the palate. The other investigation is endoscopy, putting a telescope in the nose, looking at the palate from above and watching how it's working.
The things we need, that a place for this team to be at one time or one day to assessing the patient. Because our team here, when the patient come to us, it will be seen by the plastic surgeons, and we will send him to the ENTs, and we will send him to the maxillofacials in another place. That will be difficult for the patient sometimes, because the families of this patient are poor family. The transportation from this area is costly, and they will not go to that, so there will be interruptions. But if we are being in one center, we will deal with the patient or assessing the patient in one day with all the team member. It will be very good, and we will decide a good decision, and will be helpful for the family, and of course will be the result very good.